Assalamu alaikum. Hello everyone. My name is Awab Masaad, and this video will be part of 3 videos that me and my colleagues will be talking about the abnormal gaits. Alright, so let's begin. So before I talk about a number of abnormal gaits, let's remember how the normal gait works. Alright, so we have the heel strike, the weight bearing, and the push off, and then the swing. But the general 2 phases: the stance phase and the swing phase. So I divided the abnormal gaits based on those 2 phases. Alright. In each phase, there is a way, let's say, that the lower limb behaves. Alright. For example, in the stance phase, there is hip extension, there is knee extension, and at the end, as you can see here, there is plantar flexion. Of course, this is not a plantar flexion. That's why there is no arrow here. This is the plantar flexion. Okay. And swinging to the swinging leg, we have the hip flexion, the knee flexion, and dorsiflexion at the end again, preparing for the heel strike. Alright, so again I'll be talking about abnormal gaits in in different phases: the stance phase and the swing phase. Alright, so starting with the stance phase or the stance leg, we have hip extension, we have knee extension, and plantar flexion. And again, just to make sure that everyone knows that this is plantar flexion. This is not plantar flexion. This is plantar flexion. And how this works specifically? Well, there are 2 components to this. There are the muscles and the tendon. So the muscles, the gastrocnemius and the soleus muscles, mainly the gastrocnemius, they contract, and through the tendon connecting them to the calcaneus, they will pull or let's say produce this plantar flexion. Alright, and this is the normal. But if we have weakness in the muscles or rupture in the tendons, that means that we won't be able to have a normal plantar flexion. Alright, and based on that, meaning that we won't have we will have actually a weak push off, or in other words, insufficient push. Alright, and basically an insufficient push again is led or caused by a weakness in the plantar flexion, caused by weakness in the muscles or rupture in the tendon, the Achilles tendon specifically. Alright, and for the another component is the hip extension. You know how the hip extension is produced by 2 things or 2 muscles: the gluteus maximus or the hamstrings. But more commonly, the hamstrings are affected, or they get weak. And we can see there the iliotibial tract and then some of the hamstrings, like the bicep femoris, semimembranous, and semitendinosus muscles. And the course of those muscles, right? They connect, or their origin is for example, most of them the ischial tuberosity, and then they insert in the posterior side of the tibia. All right, so they go through 2 joints, the hip joint and the knee joint, causing extension of the hip, flexion of the knee. But for now, for the stance leg, I'm concerned with the hip extension, right? So if there's weakness in those muscles, I would have problem in extending or elongating my leg. As you know, the stance leg mainly concerned with elongating the leg for weight bearing. All right, so because the leg will be shorter, again because we don't have an extended hip, we'd have another way of reducing that. That will be the vaulting gait, or the vaulting gait, which is basically a plantar flexion throughout the whole stance gait. Usually we have plantar flexion, right? But usually at the end, just before the swing phase. But here, in the vaulting gait, we have plantar flexion throughout the whole stance gait, the stance phase. All right. Now, for the swinging leg, we have the hip flexion. We have also the knee flexion and dorsiflexion. Again, this is not a dorsiflexion. You know how the dorsiflexion looks like. Okay, so I just talked about the hamstrings, remember, and how they extend the hip and flex the knee. Now, in this case, in the swinging leg, I'm concerned with the knee flexion, right? So a weakness in the hamstrings will do 2 things. It will cause a problem in the stance leg, right, causing the vaulting gait. And here it will cause weakness in the flexion of the knee, all right, and leading to hip hiking. Hip hiking basically is produced by, as we said, the weakness in the knee flexion, or weakness in the hamstrings, and also the action of some of the abdominal and spinal muscles that will try to pull the leg. As you know, the main goal in swinging leg is basically to shorten the leg so we can swing it, so we don't hit the ground. All right. So this is again, like a lot of those pictures are from the lecture, but I just added this part, presenting or representing an abdominal muscle called the quadratus lumborum. All right. So just to give you an idea how it looks like, when this muscle contracts, it pulls the whole limb up, so it can shorten, so we can have, let's say, compensate for the weakness in the knee flexion. All right. And for the last gait I'll be talking about, it's a simple one. It's the swinging out to circumduction gait. Basically, it's caused by when there is a hip flexion weakness, for example, the iliacus muscles, and another type of muscle, the abductors, like the gluteus medius and minimus, will come in action to work as hip flexors, basically to just shorten the leg again, which is the main goal. So you see how this is how normal the length of the whole limb usually, but when you abduct it, you shorten it, right? So that's what they are trying to produce, basically. The patients who have weakness in the hip flexion and come with circumduction or swing out gait. All right. So just a quick recap about the things I just mentioned, or the abnormal gaits that I talked about. All right. So the swinging out or circumduction gait caused by weakness in the hip flexors. We have the hip hiking, which is weakness in the knee flexion. The vaulting gait, which is weakness in the extensors of the hip. All right. And the insufficient push-off caused by, for example, weakness in the muscles or rupturing of the Achilles tendon for whatever reason. All right. I look forward to get a feedback from you guys, and thanks for watching.